So I'm a board certified psychiatrist and have helped over 160 PMHNPs gain clinical confidence in their psychiatric diagnostic skills, their treatment skills, and helping their patients get better results and helping you manage complex cases. And so in this video, we're going to be covering the differences between a psychiatrist education and a PMHNP education. So I've been doing a lot of TikTok live streams and I've been chatting a lot with my students. And something they tell me is that a big reason they join our coaching program is because they are finding that their education was not enough. So they go through NP school, they're like, hey, okay, yeah, I want to be a provider. I've been on this floors for X amount of years and I've worked in psych and now I want to be a provider. But then they get through school and then they see patients and then they realize that, oh crap, this is harder than I thought it was going to be. And I didn't receive enough teaching for this. Like, I feel like I'm drowning right now. Because what happens, a lot of them will get through school, they'll realize that, oh wow, they just taught me nursing theory or leadership or an essay writing classes and sure I passed, or the questions were very simple, but now I'm out here seeing 20 patients a day and I have no idea what I'm doing and I feel like I'm drowning. And these are complex patients and nothing I do seems to be working. So that's why I really wanted to highlight the differences between the education, and so I can share how psychiatrists and PMHNPs can work together collaboratively using our strengths together. The first thing and the most obvious thing is the degree. So psychiatrists and PMHNPs, they have different degrees. So psychiatrists will either have an MD or a DO. So that's the Doctor of Medicine or Doctor of Osteopathic Medicine. Whereas Ps, they'll either have an MSN, so Masters of Science in Nursing, or a DNP, Doctorate of Nursing Practice. So either or, that's the degree that they have. So that differs too. So, I mean, that's the easiest thing. The next thing is the undergrad. So in undergrad, pretty much you can do any major, but as long as you do pre-med, prereqs. So you have to take classes like chemistry and biology and physics and some psychology classes and other things, and you have to do volunteering, shadowing, all that stuff just to get into medical school. But basically you're going through it like a pre-med unofficial curriculum, but you can major in any major to get that. But you have to do the full 4 years of it. Whereas for nursing, typically you might do 4 years as well, and you do a nursing degree or a bachelor degree. So there you're getting a lot of the floor experience. So that's the difference there, because you can already start off getting your BSN. Then for graduate education, for psychiatrists, we go through medical school. So whatever you've heard of medical school is probably true. Like, it is hard AF, but you do that. And then usually 60 hours per week. And then for nursing, it's about 2 to 3 years of an NP program. So that's that. So that's a little bit of difference there, just the lengths of the program, but also the intensities of it. And then there's the postgraduate education. So for med school, after that, you have to do a residency. And so residency is pretty much 4 years where you're working under a psychiatrist, under many psychiatrists, you're getting a lot of supervision, you're rotating through all the different areas of psychiatry: inpatient, outpatient, geriatric, forensic, consult liaison, VA, pretty much every setting in psychiatry that you can think of, sleep medicine, you rotate through, so you get that full experience there. And that's what really gives the foundation of being a psychiatrist, is that residency experience. Whereas in the nursing side, you don't need that. So now some people do take a fellowship or residency, so optional, I'll write that. But usually these are typically 1-year programs and their quality may vary. Whereas residency is a very standardized process. It has to meet a whole bunch of select metrics and has to be able to offer a standardized education. Otherwise, the residency loses what's called accreditation, meaning that it can't function as a residency anymore. Whereas a lot of these are a lot less regulated. So that's the difference there. The licensing exam also differs a lot. So for us, the licensing exam is that we take the USMLE, or DOs take what's called the COMLEX. Basically, they're like big standardized tests that are 8 hours long. but then you take 8-hour tests, pretty much spanning all that we've learned in the medical curriculum. And there's a step 1, there's a step 2, and then there's a step 3. So basically there's 3 different tests that you take in medical school and then 1 in residency. Whereas for nursing, you take the NCLEX, or you take your PMHNP boards, usually from the ANCC. So, and this is for RN. So those are the differences in boards. I've heard a lot of people say that nursing boards are easier. These are things that I've heard. I've never taken them personally. I've had students say that they're very hard as well too. So of course, hard can vary. But I think the point is that standardized testing is both part of our education, and it's a very big part of medical education. Like, you have to pass these standardized tests, especially these ones, in order to practice. But then after that, you also have to take a board exam. So you have to take a board exam to get certified in psychiatry. And this is 8 hours long also. And this pretty much also spans the entirety of the psychiatric curriculum. So the total years, for example, I'm 32 now. So I spent 4 years in undergrad, 4 years in med school, 5 years in residency and fellowship. So 4, 8. So just getting through the whole process takes about 12 to 13 years. Whereas for the NP side of things, it's about 6 to 8. Not counting any type of like work experience or clinical experience that we had, but just about 6 to 8 years overall. So there's definitely a time length of gap too. And plus the intensity, like residency is a very intensive experience. All right, intensive. It's pretty much like an internship that you do for 4 years. So that's really important to acknowledge that as well. So RX authority. This is a topic that's getting some controversy, especially for independent practicing states. So for us, like, we have full RX rights everywhere. You have to get state licenses, but basically my right to prescribe as a physician, I can do that in the US and I can treat patients independently. Whereas if you are a NP, then you cannot. So full in some states, but other states, you have to have a collaborator. And so that's important to acknowledge. The system is kind of saying that, hey, we want a psychiatrist, or ideally a psychiatrist, to be supervising you, to making sure that the clinical care that you provide is adequate. Because something that a lot of my students tell me is that they felt like their education was not enough. And that's not your fault. It's not your fault that the system is pretty much setting you up to take your money and just pumping you out so that we're out in the workforce trying to figure it out yourself. Their goal is just to make money off of you. But that's a whole separate video. And then the scope of practice. So both of us treat patients, but where the psychiatrist really differs is that they are the team leaders. So when you have a multidisciplinary team, you might have psychologists, social workers, nursing staff, NPs. You kind of have this whole amalgamation and this mix. Psychiatrists are usually the team leaders of that. It's because they've had the most expertise, they've had the most education, and so they're the ones who are really able to kind of see the whole forest, but then also be able to deal with more of the complex cases. So generally, the way that it might work, you might see this in many outpatient practices, is that a psychiatrist might do the initial evaluation for the patient, and then the follow-ups, they might have the NP see them, or in the hospital system, the NP might see the patient, for example, I was working in the GI service, and then the GI NP would see the patient first, and then they would staff to the attending, and then the attending would come in and then make the treatment decision. But then the NP would be the one who's doing the day-to-day follow-up. So I think money is really important to talk about. So this is just salary. I'm not talking private practice or anything like that. So in undergrad, making zero money. Med school, you're taking out about $50K in loans, give or take. My debt is about $200K, $250K. Yeah, and it's getting more expensive. I went to a state school, so if you go outside of a state school, it's more expensive than that. So, at least $200K in debt for the 4 years. But then residency, you make $50 to $60K for 4 years, $200K debt, $200K plus debt, $50 to $60K for 4 years, salary. And then after that, $250 to $300K salary, give or take. Whereas I think this is where a lot of residents get frustrated, is that NPs, like you'll have less debt just because you might go through less school. So maybe it might be like 60, 80K debt, 60K, 80, let's say 100K for schooling. But then you'll start off making twice as much. So you get out sooner, because remember, we go through 4 years, NP goes through like maybe 2 or 3 years. So you get out and you might be making 120 to 200K. I've seen, I mean, there's a various range. So you start making that immediately as an NP, and then you, depending on the job you go to, and then that can pretty much just continue on. And as you get promotions and, start doing other things, that can go up. So there's definitely a salary difference as well, where as a resident, you start lower. Well, you start with higher debt, and then you're in getting shitty pay for a while, for 4 years, 4 or 5 years. And then it shoots up to your proper attending salary, whereas an NP will come out of training and then immediately start making good money. So that's the difference right there. I mean, not showing shade or anything. It's important to understand these things. It's important. But that's what I really want to highlight here, was the differences. Because my view is that we all work together as a team. And the best way that teams can work together is if they understand each other and they respect each other, right? And that shared respect comes from shared understanding. And so I know there's a lot of hate between physicians and NPs, and a lot of physicians will talk shit about NPs. I mean, I don't agree with that. I think that we're all here together. We're all here to take care of patients. If you just go outside, you just touch grass, you will see that there's more than enough patients out there for all of us to thrive. So I don't think there should be any kind of competition or scarcity mentality between us. And it's a team approach, right? Generally, like, I've seen them work together. The NPs might take the less complex cases, physicians take more complex cases, or physicians might manage a group of NPs so that way they can supervise them, or NPs can also help expand access of care to a lot of rural areas and reach some populations that, just there's not enough volume for us physicians to be able to reach them. So that's why my view is that if I want to solve this mental health shortage, then I would rather use this knowledge and then teach other people who are practicing. So that way, instead of me just seeing patients one by one, which I still do, I can have more of an impact if I spread this knowledge outward. So I hope this video is helpful in just illuminating just the educational differences that we have. So I work with over 160 PMHNPs right now in our coaching program, and where I teach them confidence building in their psychiatric skills. So with psychiatric diagnosis, psychiatric treatments, and helping you deal and manage your complex cases, so you get rid of imposter syndrome and you feel much more capable as a provider, so that we can get more promotions, you can make more revenue in your private practice, and your patients can actually get better. So if that interests you, you want to really level up your psychiatry skills, then consider joining our coaching program, Level Up Psych Academy. And yeah, I will see you in the next video.